people often come in and they're worried that they're going to have surgery. When someone gets injured, how can I get right back to doing the things that I love? And also, how can we prevent the likelihood of getting injured before it even occurs? Ideally, we'd like to get 60 milliliters of blood, and then we spin it. That allows us to separate the platelets and the plasma and the red blood cells.
How to speed up recovery with injections.
Oh, I like that. You did a really good intro there.
Did you see how I didn't go up when I made the point? I went down.
Went down.
See, years in broadcasting taught me that injections, right? You don't do the question mark.
We can all settle into that.
Let's settle into this very important topic. Look, we have a lot of fascinating things on the table. My coffee cup has nothing to do with the injections. Early morning, sometimes you got.
Sometimes you got to do it. You got to do it.
Sometimes it's LionAide, which we love here.
Yes.
And there's a link in the description.
Thank you to LionAide for sponsoring us.
Yeah, fantastic energy. But is LionAide tell me about LionAide as a source of caffeine.
Well, I think it's a good plant source of caffeine. It's a plant-based. It comes from actually green tea, and it also has a variety of different vitamins in it. So it has B vitamins, your methyl B12, it has B6, B1, your folate, methyl tetrahydrofolate is what it has, which is actually methylated vitamins. Definitely more quality vitamins than you're going to get in other drinks like this. And then it has a wonderful blend of Chinese medicine adaptogenic herbs and
ashwagandha.
Yes,
I've studied the label.
Ashwagandha. It's got Korean ginseng. It's even got some cayenne in there for thermogenics. So very, very good for your workout.
I took a scoop this morning, and I saw you at the gym, and then I'm having coffee after. Okay, the flesh is weak. I'm not perfect. I'm trying. But this is a wonderful source of caffeine. Anyway, we're talking about activity. We're talking about people getting injured, whether it's pickleball, tennis, golf. There's other sports than that. I was just thinking of like a retired person.
Pickleball's great. We see it a lot up here, and there are a lot of pickleball injuries. And honestly, it's a very serious sport now. They don't take it. It's not light. I have patients who are installing rebounding boards and pickleball places in their homes, right, or in their work facilities, and so that they can get those reps in of swinging.
Really?
Oh yeah. Yeah,
so people take it serious.
Yeah, it's legit. It's legit for sure.
All right, so what do we have on the table, and what did you want to talk about today? I know PRP, ozone, homeopathic nutrients. Is this injury prevention? Is this treating injuries? What's the deal with injections here?
Well, the biggest deal is, okay, when I do get injured, and you see this in sports all the time, but when someone gets injured, how can I get back to activity as quickly as possible? That's what today's podcast is about, ultimately, is how quickly can we recover and how can we speed our recovery? And also, how can we prevent, because a lot of these are also preventative, but how can we prevent the likelihood of getting injured before it even occurs? So that's really what it's all about. How can I speed my recovery? How can I get right back to doing the things that I love faster?
Dr. Ron Dummar, Community Health and Wellness here in Heber City, Utah. This is the Be Well Now podcast. I am remiss if I don't mention that. And I'm a patient and friend of yours, and we've been doing this podcast for years now. You do a lot of things here. There's a big umbrella at Community Health and Wellness. When folks come in and say, hey, I've got a sore something or whatever, do you send them somewhere else, or can you take care of them here?
Oh, yeah, that's a great question. Thanks for locking and loading that for me.
Okay.
That is absolutely a great question. With aches and pains, soreness, people often say, I don't know if you can do elbows, or can you do shoulders or knees? And absolutely we do. Knees, ankles, shoulders, elbows, hands, wrists, fingers. So we do address the whole list of injuries with regards to shoulders, elbows. In fact, we do that every day. I would say there's extremities that I'm treating, whether it's the shoulder, the hip, the knee. Every single day we're treating them. So tendinitis, tendinosis, any sort of ligament sprain or strain to the muscle, we address it all.
So where do we start?
Well, let's look at let's say somebody comes in, they've had an injury on the pickleball court or elsewhere, a shoulder injury, and they're wanting to know, hey, what do I do? I want to get back to active. How do I do this as quickly as possible? And maybe a stepwise, what's my approach? Well, the first thing is we want to assess the strength of it. So we'll assess the strength of the muscle and see if it's performing well. Okay, that's the first thing. And so we want to reactivate the muscle if it's weak. And sometimes just reactivating the muscle, getting the blood flow in there, doing some very specific, sometimes needling work right on that tendon will bring the healing tissue to that area, and that's all we need.
Needling work?
Yeah, it can be like dry needling, acupuncture, tissue work. We'll do muscle activation sometimes, or even gua sha or scraping. So any of those type of techniques are really our first go-to. It's like, hey, can we get the result with minimally invasive approach?
That's your whole philosophy here, right? Is how can we, stepwise, how can we achieve results by being minimally invasive first? Yeah. It's funny because well, so fascinating. My main thing is I do detailing, and when we talk about polishing paint, it's a plastic, it's a clear coat, and there's a finite amount of it. It's like
to protect the paint.
Your clear coat is actually thinner than a Post-it note. And one thing that we teach is always choose the least aggressive method first when you're polishing paint.
Yes.
Because if you take a really aggressive pad and buffing liquid, you could actually burn through the clear coat if you're too aggressive. Anyway, it's fascinating to hear two different fields where it's like you were saying the same thing. Always start with the least aggressive method first, right?
Yes.
We don't have to take out the chainsaw right away if we don't need it. Anyway, that's a random tangent from me, but that's pretty normal. Yeah,
but also people often come in and they're worried that they're going to have surgery.
Yeah.
And so that makes a lot of sense. And it's like you jump right to saying, gosh, do I need surgery? And the reality is, in most instances, 85 to 90% of cases, you don't need surgery if you address it properly and if you address it as early as possible. So yeah, we can get in there, address it, say, is it tendon? Is it muscle? Is there a weakness? Is there some sort of connection between the brain, the nerves, and the muscles that aren't activated like they should be? And we can reignite that either using acupuncture, tissue work, muscle activation. That's our first approach, really.
Okay.
So yes, minimally invasive.
Minimally invasive.
So then if that's not, if we don't get the results that we want, or we want to be more aggressive, which we may need to do based on what we find. If it's already strained, the muscle's injured or the tendon's injured and there's inflammation, or even if it's been going on for a while for the patient and literally you're in a more of a disease or a chronic state where you have tendinosis in that tendon, what we'll then look at doing is something like homeopathic or ozone injections. So homeopathic injections are essentially diluted herbals, diluted anti-inflammatory herbals, diluted pain-relieving substances. So it goes highly diluted, but we inject it into the tendon and the muscle to stimulate a response and to put those nutrients right there in the spot that they're needed.
So is this like, are you talking about peptides or no? What are you referring to here?
The homeopathic nutrient injections.
This is like an ozone injection? No, this is different.
This is different, yeah.
Okay.
So the homeopathic nutrient injections are actually like herbal injections. They're diluted. Homeopathics are highly diluted, and they're succussed and they're shaken, and there's a process that goes into making them, but they're highly diluted substances. So we take those substances and we inject them by essentially using a needle and syringe. But then what we're doing is delivering the nutrients that are needed and necessary for tissue repair, right? If you don't have the actual building blocks to build the house, if you don't have the building blocks to build the tendon, how can you rebuild tendon or heal it? So we put the nutrients that it needs directly right there so it can actually rebuild that tendon and heal faster.
So give me an example of what the issue would be and what you would use.
So somebody comes in with lateral epicondylitis, with a tennis elbow injury, right? And they're like, it's really, really hurting me. I can't swing. Every time I hit or swing, it's bothering me. And so I can't do my sport. So what we would use in that instance is, what I would probably use is homeopathic injection. So I would inject nutrients directly onto the tendon, and very likely even really close to that lateral epicondyle where that bone is, the tendon attaches to the bone. And then I would follow that, as you mentioned, with some ozone. And so I would put the nutrients in so that we have the nutrients right there, and then I put the ozone. The reason we do the ozone is that it hyperoxygenates the area. Oxygen is going to heal. If you can get oxygen into the area, it's going to help heal. Also, those oxygen molecules will stimulate a response in the body that is slightly agitating. So that slight agitation to that area draws attention of the body and the immune system to that area to speedily recover, to help it have a healing response. So the immune system goes, hey, we have to be aware of this. Let's initiate a healing phase. So we go into healing phase, whereas before it was just chronically inflamed, chronically irritated, maybe had inflammation that initially even suppressed it or began to decrease the blood flow. So it becomes dehydrated, not able to get proper blood flow, and it just becomes super chronic. So we get the nutrients in there, we stimulate the response, the brain and the immune system say, okay, we've got to be really readily aware of this area, and it heals it faster.
I've never had an injection. Give me some stories of people who've had it happen and did it work for them?
Well, one thing that actually sticks in my mind right now is earlier on when I started doing them, but we've had lots and lots of really great experiences with it. That's why we're obviously still using it all the time. But I remember injecting in a patient's shoulder, just under her scapula actually is where we injected in the subscapularis muscle, and she was having difficulty reaching up to do her hair. A variety of different movements were very, very painful for her. And we did some tissue work, and it made it a little bit better. It improved it. The strength improved, but she just wasn't quite getting to where we wanted her to be, where there was no pain, and she felt like she could have full range of motion. So we did the injection. This was just homeopathic nutrients, no ozone. And she immediately lifted her arm. She's like, wow, is it supposed to work that fast? And she had full range of motion, no pain, no inflammation, and we never had to do another injection on her. Now, typically my process is we do one injection a week for 3 weeks. That, with homeopathic and nutrient injections, that's what we tend to do, and I've found that it works the best that way for patients to help speed their recovery.
And you don't always need ozone, or you would follow it typically with ozone?
Generally now, I'll follow it the first two with ozone, and the last one is just nutrients.
Gotcha. When are you ready for something else, like platelet-rich? What is PRP?
Yeah, good. So platelet-rich proteins, platelet-rich plasma.
Because this looks pretty fancy. Is this what that is?
This is to help get the platelets out. Yes.
Okay. All right. Continue on.
So we can talk about that process, but PRP stands for platelet-rich plasma. So the plasma is a part of your blood that flows through your vessels, and we extract that, or we take the blood and then we spin it, and we spin it through a certain cycles at certain speed, and that allows us to separate the platelets and the plasma and the red blood cells. So we separate that, and then we put it once. Basically, let me tell you what we do.
Well, so you're not going to just tell; you're going to show and tell, which I love. If you're watching on YouTube, if you're not, you've got a what is this?
I have a syringe.
Syringe.
This is actually a 60 milliliter syringe.
Okay.
60 mil there. And what you'll do is essentially we're going to draw as much as we can get. Ideally, we'd like to get 60 milliliters of blood. Okay, so we draw first, and then we take that and we'll put it into this device right here that goes into, this fits actually into the device that we're going to spin it in. And so we put it right in here.
Hold on, let's make sure the camera can see.
So we've fastened it just like that. Once we have the blood in here, we'll put it in like this, and we'll push it down into there until the air. It's airtight, so we'll push it down.
Okay,
right there.
got it.
Okay, and once we have the blood all in there, we'll put it in, and we'll spin it. So once it spins, so this will turn around like that, and we have to counterbalance it. So we'll put water on another side. It looks exactly like this, a container of water, and we'll counterbalance it, and it'll spin. And anytime you have a blood draw, there's always a certain amount of spinning that has to be done in order to get the proper extraction of what we're trying to get. So once we're done with that spinning, we spin it for about 10 minutes. And then once we're finished, you'll see the separation. So we'll place this right on this device right here. And then we'll start lifting this up just like this. And we'll have this syringe right here. So we're hoping that we can get, if we can get 10 cc, if we can get 10 cc of platelets out of that, then that's actually pretty good. You're doing pretty well.
So it separates, so the platelets are easily...
So it's separated now, and essentially we put this right in here, and then we just push this up, and you can see how this is moving up that green, and see how this is moving.
Yep.
So we just push it up until we have all the platelets that we need. So once we've got all the platelets out, we have that in that syringe, then we can take the platelets and get them prepped specifically into the syringes that they'll be injected from. And then we can inject that. We've injected it to help with hair follicles, to help with inflammation. Sometimes people have inflammation in their scalps, and it's causing their hair follicles to be brittle, which then leads to their hair falling out. And we have Rapunzel for that. This is Rapunzel. It's one of the herbal formulas that we've created to help with hair follicle.
So this is
growth.
I'm a fan of Rapunzel.
Yeah, it's great. Yeah.
Is it bad that I take it every day?
No.
Okay.
So Rapunzel, I'm always a big fan too of like taking a break from things.
Yeah.
Not doing
That's why
it every single day, but sure. I mean, if you're wanting to take it every single day to help with your hair and to help with the anti-inflammation to your scalp, I guess go ahead. So, but yes, we want to, with the PRP, we can actually inject under the scalp, right? So we inject all along the line there, and sometimes to reduce hair thinning, to decrease the likelihood of balding, and to basically improve hair growth.
So if men are worried about thinning hair or going bald, I'm guessing preemptive is much better than, I lost all my hair. Rapunzel and
PRP is a great way to go, for sure.
All right.
Okay, now that wasn't what we initially had talked about specifically with injuries, but Rapunzel I had here, and we had to talk about it. So there you go. That's one thing we can do with PRP.
Okay.
But the other thing with PRP is we'll inject it. Again, these are platelets. Now, the important thing is to recognize, why are we extracting the platelets? Why do we want the platelets? And why aren't we just taking the whole blood, right? Why don't we just inject the whole thing? Well, the reason we want the platelets is because platelets are actually like immature cells that will mature, and as they mature, they can differentiate. They can become something that they need to become. So it's like a teenager that's in school, and he's like, gosh, what do I want to do with my life? I don't know. Maybe I'll be an accountant. I don't know. Maybe I'll be an attorney. Who knows what I'm going to do with my life? So that's what a platelet is. And a platelet can actually choose to become a certain type of cell. So if you inject platelets in an area that's injured, like a tendon, and it needs to be a specific type of cell, which is tendon, then it can differentiate into that specific type of cell. That's what platelets can do. They're differentiating. And so that's really impressive. So we take that directly from your body, we inject it to the area that's injured, and then it has the programming within it that it can become that specific type of cell that is needed in order to heal your tissue.
How does it differentiate from like injecting a peptide that we've talked about on the podcast before, BPC 157? Yeah,
so BPC 157 is the difference between the platelet and the peptide is that the peptide is like an instruction molecule. Proteins, for instance, are instruction molecules that are made by the body. Peptides are short chain or medium chain, I guess is a better way of saying it, instruction molecules. You have amino acids that start stacking amino acids together, and you combine them in certain patterns, and then you have peptides. And if you combine them and make them bigger and bigger and add more to them, at some point we have a protein. It's really based on size that makes it a protein or a peptide. But either of those are instruction molecules. They like tell the body to perform or act in a certain way. So when you inject a peptide, you're giving like instruction molecules to the local cells as to what to do and how to take care of it. They're like the foreman, right? So it's not necessarily the workers. The platelets would be like the workers. They're out there saying, gosh, we got to get this hole dug. How do we do it? I don't know. Nobody's around here. Well, I'll use the backhoe. I guess I could do that, right? And the foreman more or less says, okay, we got to go get these people who can dig this hole, right? So the peptide's more like the foreman, and then the platelets are more like the workers.
Okay. That's a good metaphor.
Yeah, I think it works.
So we start with the least aggressive method possible, and then we can move up to,
Yeah, so
PRP
we want to do homeopathic nutrients, and then homeopathic nutrients and ozone. And then we could do, PRP if you want to. It's actually a really, really great service that we do, and a lot of people benefit from it a lot. But one of the preps with PRP is that we make sure I feel like are very successful. We increase our success rate with PRP because we have people take before they get their draw. We have them take nourished blood. So nourished blood helps with the body, it helps with the blood product, helps with the blood flow and circulation, so that we can actually increase the blood flow to all of the areas that we're going to be injecting, right? And also it increases the blood supply and blood volume so that we're going to be taking a significant amount of blood. We do want to be able to have enough to take, which obviously you have plenty for 60 mil. It's not like an issue from a blood supply problem, but this helps where patients who sometimes are harder to draw blood from, that just happens with certain patients, we find that they do really well after taking our nourished blood.
with all kinds of herbs I can't pronounce on there.
Blood nourishing herbs in there, and they help the spleen and the marrow, bone marrow to produce.
So let's say
blood
someone's
cells.
local to another office in another state, but they're like, hey, I want to try this nourished blood before I get it injected. Could they get this from your office?
They can. Yeah,
Okay.
They can call in, and typically what we want or what we require if you're not a patient or haven't been a patient is we want you to do a review or an exam. We do have a herbal evaluation exam and form that you can fill out, and then you can have a visit with myself or one of our doctors or therapists, and then you can be prescribed that.
One interesting comment on a YouTube podcast was, how does homeopathy work? This is a comment. It doesn't! Exclamation mark.
That's what someone answered to it.
Yeah, because the shore I put up was, how does homeopathy work? And he's like, how does homeopathy work? It doesn't.
Yeah.
What do you say to folks who say homeopathy doesn't work?
Well, the interesting thing is, when you say homeopathy doesn't work, I actually have a really difficult time understanding exactly what you mean in general by doesn't work. Like, you mean you believe it doesn't work? Is that what you're saying? I think that's really what's happening there. So there's some sort of faith-based principle that he has decided to live by that has taught him some sort of creedal belief that he can't trust homeopathy. Because you look in the world around you, homeopathy is plants. Do plants grow? Can you put a seed in the ground and it grows? Yes. Okay, well, it grows. What allows it to do that? Well, certain compounds that are within that plant. Okay, well, those compounds that are in that plant is what we use medicinally in homeopathy to heal and recover. So if you believe that you can put a seed in the ground and it will grow, then you must also believe that there are compounds that make that occur, and that those compounds also contribute to the health overall of your body. So if you believe that that process is real, and then it occurs, and then you deny the fact that it can actually be a benefit to the body, how does that make any sense? It doesn't at all. It's not congruent with the life that we live. Unless you, of course, believe in a 100% synthetic world. You believe we should all be moving around and living synthetically. And I don't believe that at all.
What do you mean by synthetically?
I mean that everything should be created ultimately by man, and out in, and the only things that exist.
Let's get meat made in a factory.
Yes, the only things that exist are things that are made by man, and that man is the great resolver of all problems in the world. Like, if that's what your belief is, I'm sorry, but I think majority of things that we interfere with in nature is detrimental, not contributory. Now, I do think that we can be very congruent with nature, And we do that by using and understanding how nature works and how its compounds work within our bodies. So there are chemicals and compounds in plants, in every plant. And we know which of those plants can benefit us and which of those compounds can benefit us. And we know also that most medications, most synthetic drugs actually are sourced in some way or they mimic compounds within plants. So they look at these plants and they say, oh my gosh, look, Chinese medicine says that this plant is used for XYZ. This plant is used for upper respiratory issues. And it really seems to help with clearing up the respiratory system so we can improve breathing and decrease inflammation in the nasal cavity and nasopharynx. Well, that's great. So what do? Oh, well, let's find out which compound in that plant we think is the major active ingredient. That's how synthetics work. So they look at it and they say, okay, we think it's this one. Okay, now how can we reproduce that in a lab so that we can patent it? Because we can't patent it as the plant and we can't patent it as the naturally occurring compound. It just doesn't, you can't patent that. But if we can synthesize it, we can patent that process and we can patent the synthetic version. Therefore, we synthesize what we initially started out as a naturally occurring compound, but now it's synthetic. And anytime you actually synthesize something, it can't be exactly the molecule of the original compound. Okay, it can't be the exact molecule. Otherwise, it's the original compound. So what they have to do is they have to add a little ligand or a little attachment to the end of the compound. So now it's not exactly, but it's really close. So it's close enough that, it's like twins, right? And you're like, wow, those twins are really close. How do you tell the difference between them? Well, are they identical? We think they're identical, but even identical twins, there's slight difference, right? And you can distinguish the difference between them, but it's really, really marginal. So that's the difference between, you could say, natural and synthetic. And also that's a very, very long answer to somebody
Right.
who's just basically said, hey, listen, like the homeopathy doesn't work. And the point is, if you believe homeopathy doesn't work, you basically believe nothing works.
We got there. I A to Z.
Yeah.
There were lots of letters along the way. We didn't skip any. I got you on that one. Thank you for your answer. So we've talked about Rapunzel. We've talked about Nourished Blood. We haven't talked about Trauma Mend or...
So Trauma Mend is on the back
Bronchial
end. So after
Okay.
you receive your PRP injection, after you get injected the platelets, it takes a few weeks before they'll fully implant and embed and begin to differentiate. So I usually say for people that 3 days after, you want to make sure you're doing like nothing, almost not even moving the area, just keeping it as still as possible for 3 days. And then
after PRP? Or
after
any of them?
PRP, just after PRP. And then for a few weeks, we want to just lay low, have light activity, no loading or lifting. And then, after 3 weeks, you're in the gold. You're good to go. So, but the reason we use Trauma Mend is because it improves the healing factors. It improves and speeds the recovery time. And so we want to draw as much as possible those healing factors to that area, and that's what Trauma Mend does. We use this with even bone fracture patients. We use it with soft tissue injuries. We use it with sprains and strains, ligament damage. We use it in whiplash patients who have joint capsule issues with the joints of their neck and their shoulders. And it helps speed recovery so much, so fast. I had a nurse who had broken her pelvis, and she was in the hospital, and she sent one of her family members to come get something from me to help her heal faster. And that was one of the reasons we actually developed Trauma Mend. And it sped her healing up. The nurses and the staff in the hospital couldn't believe how quickly she healed and how fast her recovery was. And she attributed it, and we're grateful and honored that she did, but she attributed it to Trauma Mend.
That's awesome. It's so funny when things happen and people want to not give you credit. And then when they don't happen, they're like, natural medicine doesn't work.
Yeah.
Like
Yeah,
I
for
just
sure.
went to this convention and we tried some homeopathy, homeoprophylaxis.
Oh yeah, yeah.
The COVID,
HP.
the COVID influenza one.
Mm-hmm.
And I didn't get sick for the first time in 4 years. And I'm like, well, maybe it just wasn't a big semen.
Yeah, like every time you've
I'm
gone
like,
down there,
every
you
time
got
I've
sick.
gone, I got sick.
Yeah.
And this time I didn't get sick. I'm like, maybe it just wasn't a big flu year at SEMA,
Yeah.
which is the
Yeah.
automotive show. And I'm like, why am I trying to undermine
Yeah,
the
it's
thing?
easy to undermine it when you're like,
we
"Oh,
tried
nothing."
HP
Yeah.
and I didn't come back with COVID or the flu. And this is the first time in 4 years. And I'm like, maybe it actually works. You know,
Yeah.
even I'm the
Yes.
skeptical mind.
Yes.
So very cool. And then we have Bronchio Heal and then this.
Yeah, so the hypochlorous, I put
Hypochlorous.
the hypochlorous out here just because a hypochlorous helps us with keeping all of the area clean, and we can even wipe down the area with hypochlorous to make sure that we have really clean surface to inject through so that we're not spreading or contaminating anything. We obviously do use alcohol wipes also, but hypochlorous is very, very benign, but it's a very good cleanser too, and it's non-toxic. So that's why we like to use it.
And then Bronchio Heal?
Yeah, Broncho Heal for the lungs. We use this. I had a patient just yesterday, actually, a PRP patient, believe it or not, but he replied to me in a message yesterday, and he said, boy, that Broncho Heal was like magic. As soon as I started using it, it turned my lung issue right around. And he's like, do you have anything else for? And he started asking me for other, advice for other issues that he was dealing with. So that was super cool to see. And it's fun to hear people, when you've created something, you hope that it works. You want to add value. And that's what I want to do, is add value as much as possible for patients, and to hear their success stories, and to hear their bodies basically receive the nutrients and perform and respond in the way that is beneficial as possible to their bodies. It just makes me happy.
Well, that's a good way to end, I think, this episode of the Be Well Now podcast.
For sure.
You feeling that? You feeling like it's a good time to
good.
end? Yeah. How can they learn more about PRP if they want to get it, if they're local to the Utah area? We're up here in Heber City, but you have folks from all around coming. How can they find out more?
Well, you can find us online at chwheber.com. You can also text or message us directly through our phone, which is 435-657-3696. And that will message directly to us, a messaging center, and we can see those messages come through and communicate with you if you want to have any more information. Or you can stop in by our office. We're at 345 West, 600 South, Suite 401. We're right here in the Rec Center building in Heber, Utah.
Be well now,
Come say
everybody.
hi to us.
Come say hi. Namaste.
Namaste. Be well now.